colleagues. First of all, I want to thank the organizing committee for the honor to speak at the Congress. Let me introduce myself. My name is Vladimir Chubarovskii. I am a professor of Sechenov University, a psychiatrist. The term of my short message is the effectiveness of primary psychoprophylaxis of somatic and mental pathology in adolescents according to the clinical epidemiological research. At the turn of the 20th and 21st centuries, mankind was faced with new challenges that cause various forms of psychosocial maladaptation of significant groups of the population. The most defenseless are children and adolescents. Topical reasons for studying the state of mental health of students of adolescents are the following. 1. A sharp increase in the prevalence of borderline mental disorders and behavioral disorders. 2. Hyperdiagnostic of mental pathology. 3. The critical importance of adolescents in relation to the formation of an adult personality. 4. Exceptional social significance of the problems of mental disadaptation of the emergent personality. According to the literacy data from the secondary researchers, prevalence rates of mental pathology in adolescents in various regions of Russia range from 0% to 140%. Some experts note a connection between the information load and an increase not only in borderline mental pathology, but also in diseases such as schizophrenia. According to the long-term observational studies of our institute, 11 to 15% of the examined adolescents need a psychotherapist. More than 30% of students find the pre-painful mental conditions. The pre-painful conditions are understood as monosymptomatic, stereotypical forms of disorders that occur one or more times a week without a pronounced social maladaptation, but disturbing the patient. In adolescents, they should be considered as an adaptation reaction. With regards to prevention and promotion of the health of children and adolescents, the European Health School movement is of paramount importance. The most important principles of movement in Russia were formulated by academic Vladimir Kuchma. These are the following. Construction of the learning process of the principles of mutual respect of teachers and students. Formation of a health culture of teachers and parents. Improvement of social partnership in the teacher-students-parents system. As a result of a survey of 146 adolescents, 40 to 70 years old, students of grades 8-11 of the Education Center Lukomoria, School of Health, using clinical, epidemiological, and psychological methods, borderline mental disorders of varying severity were diagnosed in 46% of the survey. There were no significant difference in the prevalence of disorders by gender. In structure of disorders, both in boys and girls, 65% belonged to the premorbid conditions, neurotic and pathophysiological reaction. The results of the survey of 200 adolescent students in mainstream schools and vocational college are presented in the following table. The overall prevalence of mental disorders was significantly higher at 67%. revealed a significant predominance of disorders in college students, 82% versus 53%. This situation was due to a significantly higher frequency of occurrence of pathopharmacological reaction manifested by deviation of behavior. At the same time, the proportion of syndromic pathological conditions was significantly higher. Comparative analysis of the prevalence of painful mental manifestation between the health school and regular schools amongst boys and girls revealed significant differences. So among the boys of leukorrhea, the overall prevalence was 39% versus 59% among ordinary school children. The difference amongst girls were even more pronounced, 51% versus 79%. The analysis of the prevalence and structure of premorbid personality traits of students of the health school, depending on gender, presented in the following table. So, the indicator of the general prevalence of flats with accented features was 37%. At the same time, accentuation was much more common in girls, 43% versus 31% in boys. In girls, hyperthymic and emotional label types are significantly more often diagnosed, and the unstable type in boys. A comparative analysis of the prevalence of accented premorbid personality traits in students of educational institution of various profiles revealed the following patterns. The highest frequency of accentuation was found in students of regular school, 97%. In colleges, this indicator was slightly lower, 73%. And the most of favorable situation was in the School of Health, where the frequency of accentuation was 37%. The revealed features indicate a more favorable course of the negative phase of the adolescent crisis in adolescents in terms of being in the health school. It should be noted that of adolescents with borderline emotional and behavioral disorders in all educational institutions, less than 2% were previously consulted by a neurologist or psychiatrist. Iceberg morbidity exceeds 90%. This situation is due to the low appeal of adolescents and their parents to specialists in connection with fear of consequences of psychiatric stigmatization of the child. In the study of recent years, we have described the phenomenon of social psychiatrophobia, expressed fear of parents, a significant part of teachers, young people before the possibility of psychiatric stigma and extremely adverse social consequences. The foregoing allowed us to draw the following conclusions. The state of psychosocial health of the younger generation of the country requires the development and implementation of emergency, comprehensive intersectoral measures to strengthen it at the macro-social, micro-social, and personal level. The prevalent structure of borderline mental pathology, behavioral disorders, and character accentuations has pronounced difference depending on the gender and profile of the educational institution. The proposed and tested medical, psychological, pedagogical model of the Luca-Mori Health School provides effective psychoprophylaxis in relation to borderline mental pathology and the harmonious course of pubertal crisis. The interdisciplinarity of the problems of protecting the psychological health of students requires the development and implementation of expanded section on the features of manifestation, prevention, and correction of various forms of mental health in the training programs for medical specialists, teachers, psychologists, sociologists, management of children and adolescents. In conclusion, let me express the hope that in near future, our teenagers will look something like this. Thank you for your attention.